Hi, I'm Buddy Creech. I'm professor of pediatric infectious diseases at the Monroe Carroll Jr. Children's Hospital at Vanderbilt, and I'm a board member of Cumberland Pediatric Foundation. Here with me today is Chetan Mukundan, who is vice president of CPF and a pediatrician at Heritage Medical Associates. In this two-part series, we're going to start with COVID and talk about the pandemic, where we've been and where we're going. And then we're going to shift gears and talk a bit about HPV, moving from pandemic to prevention of this cancer-causing virus. But let's first start with the pandemic. Chetan, thank you for being with me today. And I think we go back to the beginning with this. That's where all stories should start, is at the outset. So tell us again what those early days of the pandemic were like for you, because one of the things we share in common is that we're early adopters of iPhones and pandemic viruses. So walk me through that process for you when you were first diagnosed with COVID.
Well, we really were early adopters. And so it goes back to March of 2020. At that point, I think people thought COVID was going to come and go and pass and it'll be gone. And we picked it up at a party. I was in the office, I had an exposure that I did not know about, and then gradually I started finding out, well, one mother's sick, another mother's sick, two parents are sick at one house, and it was adding up, and lo and behold, I've got like 7 or 10 exposures, but I have no symptoms. And so I checked with the health department, I checked with infectious disease to try to figure out what I should do, if I need to be quarantined. And the thought was I needed to be checking my temperature every day, and this was back when we were checking temperatures daily, and never had fever, and so I kept going to work. And so the party was on March 7th, and then March 15th I had my first symptom. And so then I thought, well, I need to go get tested. So I went to a walk-in clinic, which I'd never been in before, because as healthcare providers, we don't generally have to go to walk-in clinics, and so that was a new experience. And they asked for my symptoms, and they asked what my temperature was, and I may have lied about how high my temperature was so I could get a test. 2 days later, and that was a long 2 days of waiting and checking the app to see if the results had come back. But I got a result saying that my test for SARS-CoV-2 was positive. So at that point, I went into quarantine mode. And in my house, we have a basement that I could quarantine in by myself. And I really had started quarantining when I had the first symptoms on the 15th. Sure. So I stayed in the basement, and I called our chief medical officer to say, I have COVID. I think he almost wrecked. He was in his car on the highway. He pulled over, and then we talked through it, and then we called Shelley Fiscus, who was with the state, and she kind of guided me through what I needed to do, which was I needed to notify everybody I'd been in contact with the previous 7 days. So
which is a remarkable number of people, given the party and your office and all of the things.
Exactly.
Right?
So it ended up being about 150 families in the office. I think everybody at the party had been notified by other people, so I didn't have to notify them. But it ended up being families that were on vacation, because the following week was spring break. And so then some families were not in town. They find out that they've been placed in quarantine. They were having to drive back to Nashville. And I feel like personally responsible for ruining their child's vacation. So those were like the earliest memories, and for the most part, people were very understanding. They realized, well, my attending a party was just something they probably did that same day, because life was pretty normal on March 7th of 2020. March 15th of 2020, life was not very normal, and so in a week things had changed considerably.
Well, I'm impressed that by you just kind of reviewing that, it's bringing back so many memories of that time for me, because I got sick just a few days before you did. Same experience at the walk-in clinic, same light fibbing about how high my temperature was so I could ensure getting a test. I remember getting called that evening because we weren't yet doing the volume of tests. And remember hearing my colleague on the other line say, you had to be first, didn't you? You had to get this early, didn't you? And then being really sick, but with my family. And one of the things I think that you and I experienced was infections and a pandemic done in community is very different than a pandemic done in isolation. We were talking earlier about The Plague by Albert Camus, and an incredible book to read on this side of the pandemic, really talking about how the virus is one thing, the loneliness and the isolation that comes from it is a whole other thing that at different times in the pandemic we may not have gotten right. So can you talk a little bit about that? Because I think sometimes we don't always think, as pediatricians or those in healthcare, we don't always think about the power of community during illness.
So I went into full quarantine mode. I went into my basement and I was by myself, but I did have my dog with me, who is a huge part of my life. But as I'm in my basement, I had community, and so we had members of our church, members of our community who had COVID with us, and so we could check on this app. And people were posting videos, and they were asynchronous, but then you could post your own video, and then other people could see it. And I realized, well, this was my way to connect with everybody. And the nice part was that I knew, okay, I'm their doctor. I take care of their children. If they need me to come over, I can come over because I've got COVID, and they have COVID, and there's nothing that I need to be worried about. But I think it was a great opportunity for us to connect, see that people were doing well. If I was worried about somebody one day, get back on, they're posting a video the next day, right. Or I could ask, has anybody heard about this person? And that was huge. And so I think, I can't imagine doing it by myself.
Well, I think the interesting thing is that you and I, as well as our community, many of us never had to really experience the heart of the pandemic as those who aren't immune. We had at least some degree of protection from those early infections. And I feel for those who haven't yet been vaccinated or who were vaccinated so far a long time ago that they really don't have as much protection now. So maybe we can switch into what the vaccine campaign has looked like for you, what that rollout looked like for kids, and maybe what you're experiencing as you talk to parents about COVID vaccines.
That's great. And I think, the vaccine process for us really kind of started initially with parents getting vaccinated.
Sure.
And I can look back, like at the beginning of the vaccine rollout, and parents didn't qualify, and I had parents who were driving like to other counties or other states to get vaccines where people weren't getting their vaccines. And so I thought, well, this is wonderful. They're all in, they're all on board, they're getting their vaccines. And we talked about children will be next, and we had families that opted to have their children participate in the Moderna studies that you ran, the Pfizer studies that were done here in town, and so that made me really excited that it's going to go very smoothly. So overall, we've been vaccinating children in our practice for about 1.5 years now, and I'd say the vaccine rates are really dependent on the age of the patient. So the children who are like 12 and up, I suspect we're probably 90% plus vaccinated. The children who are 5 to 12, we might be like 60, 65%. And then the children who are under 5, it's really interesting. It's about 50-50. And some of these families, because these were babies that were birthed in the pandemic, and the parents were like, we want to, they're asking me, when can I get a COVID vaccine for my child at the 2-month checkup?
Sure.
But then there are other families that are like, well, I'm just not too sure. Or there's some who are like, well, maybe COVID's not as bad as it used to be. Do I really need to get a vaccine? And my point is always, well, it's not going away. We're still seeing it.
Well, and I think that's an important piece because even now, this time of the summer, we're starting to see another uptick in the number of cases that we have. And that's okay in general. We know there are going to be fluctuations, but we're really paying a lot of attention to this because we do have waning immunity, especially in at-risk groups that are more likely to get disease and have severe complications from it. Are you still seeing new families coming in to be vaccinated? And if so, what changed for them? Why now?
Yeah, so in fact, I had 2 girls who got their first vaccine today that have been eligible for a while. I think what changed for them was they could do it in one shot now. So that was a big sticking point for whatever reason. But doing it in 1 versus 2 or 1.3 that's a huge benefit. So that's one thing. I think certainly at first there was a group who wanted to be first. We were early adopters,
right.
But then there are others who are just like, well, I want to see how other people do, and they realized, well, nobody had significant side effects. You could probably speak to the side effects, because that's something I hear about a lot.
Well, we see the normal things from vaccines, right? Fever, leg pain or arm pain, sometimes some fatigue the next day. I remember in our clinical trials early on, we had so many parents coming in for that second vaccine, and we would say, "How did it go?" And they had this look of joy on their face. They would say, "My daughter slept for an extra hour during her nap the next day." And so it met a criterion for, fatigue on the case report forms, but no one ever complained of their child taking a little bit extra of a nap the next day. So in general, that's what we saw, like we would see with other vaccines. One thing I wish we had done better early on is talk about how long we've known about mRNA vaccine technologies and even the biology of coronavirus, because these are 2 decades each in the making, and they just came together at just the right time for us to make these vaccines very quickly. So it's not like the technology was terribly new, it's just we had perfected it at just the right time. And I think it certainly did not help us that in those older teenage boys, we did see a small increase in the number of myocarditis cases, even though it paled in comparison to what we were seeing after COVID disease. Was that a big concern for parents of teenage boys, especially for you?
It was a concern that some parents raised when we would talk about, well, here's the rate with the vaccine, here's the rate with COVID. It was hard to argue with that.
That's right. And I think we as pediatricians started getting a little smarter about how to recommend that second dose, particularly for kids who weren't at increased risk of severe disease, where we spaced it out just a little bit more. And the CDC gave us some flexibility to maybe choose 8 or 12 weeks in between doses rather than the very quick 3 to 4. And we definitely saw that drop the rates of myocarditis. Well, we're about to move into a time where we're going to have better vaccines for COVID, and I'm curious what y'all are thinking about as a practice as we move into these Omicron-specific, these XBB-specific vaccines that should be available within the next 4 to 5 weeks. We think by the end of September, early October, we're going to have these widely available. How are y'all preparing for that?
So every year we start in early or mid-September with influenza vaccines, and we have vaccine clinics that run through September, October, early November. Okay. And we try to vaccinate our entire patient population. I'd say probably 3/4 of our patients get their vaccines in our office. What we've been talking about now are the XBB specific vaccines that will be coming, and what we're waiting for recommendations in terms of the number of doses and the ages and the age approvals, but we're certainly hoping that everybody can get the XBB vaccine. And I think it's very exciting because for the first time, we're giving a vaccine that really might line up with what we're seeing in the community. So in the past, by the time we were giving like the youngest kids COVID vaccines, they were getting vaccines to alpha. We were like several variants down the road. Sure. And but now we're getting the vaccine for what we're seeing. And so that's kind of this little conundrum because we are still seeing some COVID. There's been maybe a little bit of uptick in our community, and the kids are going back to school in these next couple of weeks, and we're going to see more numbers. But if we can get to the point that they can get this better vaccine, it seems like it makes more sense to wait for that XBB vaccine for some of these kids. And we also need to know, like, well, if you get the bivalent vaccine, can you boost that with XBB, or do we just wait for 2? So there's a little bit of a learning curve right now. What can you speak on that?
Well, I can, because we're getting this question a lot. And for those who aren't at increased risk, for those who don't have some family experience or situation that really demands maximum immunity all the time, we're really suggesting that now's not the time to get a boost. It's really to wait until that XBB vaccine is around, and in part because when we get even the bivalent booster, if there's a little bit of the Wuhan strain in there, that ancestral strain, what our bodies typically do is just respond in a memory way rather than making new antibodies to the new target. So we really want to take advantage of showing the immune system something completely novel so that we can make the best immune response possible. But this is a weird tale of two cities right now for me, because I'm thinking back to the beginning of the pandemic, which feels so long ago, if I'm being honest. And yet, as we talk about our experiences, boy, it comes flooding right back as if it were yesterday. And yet, we're still not out of the pandemic by many ways. We still have this virus circulating. It's not at pandemic levels. We've declared an end to it, and I understand that. But the virus is still around. And it represents a respiratory virus that we can prevent, not 100% of the time, maybe not even 50% of the time for mild disease, but it's really good at preventing severe infections. And as a result, it's going to make people not transmit it as much. And so I guess I'm curious, as you move into the fall, what advice are you going to give your partners? How are y'all thinking about how to communicate the need for vaccine to your patients?
Yeah, I feel like we have just finished our surge of school checkups, and we've been talking about through, kind of all these school-age kids saying, well, let's wait till the fall. We're going to have this new booster. And so I think the first touch point is just in the office, communicating with them with the hope that these families are then going and telling their friends, this is what our pediatrician says. But we really are pushing that, and with the hope that people will participate in the fall. And I think that they will, because we are looking at it more like we look at influenza vaccines. And we know, yes, we're in a better place. This can turn. We saw like the numbers in India and China ramp up this summer,
right.
And we're not any different, and it's going to happen here.
That's exactly right.
And the difference was that maybe we've been outdoors, we've been on summer vacation, but now school starts, we move indoors, and we'll start seeing COVID increasing. And there's a daycare in town that just got shut down last week because they had a bunch of cases of COVID, and so that can happen. And I think the rules will be different. There's no more 5 days that you're out of school, and so with that, I think we'll see perhaps more exposure because people or someone on the honor code to decide when to send your child back to school. But it'll be like flu, and I think people will stay out until they feel well enough to go back. But we might have some shedding of virus when they go back, and there'll be some exposures. So the benefit of being vaccinated goes up, and the fact that the vaccine matches is like immense. And so hopefully we're going to have a robust turnout for the vaccine, and we'll see how it plays out.
Well, and it sounds a lot like our approach to influenza, right? We acknowledge with parents that most children navigate these viruses pretty well. Some have more illness than others. Very few get hospitalized, but when they do, it can be devastating for those few children who die from influenza and COVID each year. And so what we're doing is we're encouraging vaccination for all to prevent those rare events of severity, to be able to get kids better and back into school more quickly. And I think the number of respiratory viruses that we're going to be able to prevent through vaccination is only going to grow. So we need to get our talking points together for both consistency as well as just to be able to compel parents to learn what it means to protect their kids like this. Well, thank you for joining me today on this. I think it's helpful. I think at the end of the day, we want our kids protected against a number of things, COVID included. So thanks for taking time today.
Thank you, buddy.
Jathan, thanks for being with us today. Next up, we're going to turn it to Rob Lillard as he holds a discussion about the prevention of HPV and what we can do as pediatricians to prevent this cancer-causing virus.
Hello, I'm Dr. Robert Lillard, Medical Director of the Cumberland Pediatric Foundation, welcoming you to another one of our educational seminars. And today we are talking about human papillomavirus, or HPV. HPV is the most common cause of a vaccine-preventable cancer today. And I'm happy to be joined today by two special guests to discuss HPV, Dr. Deb Freeman, who is Professor of Pediatrics at Vanderbilt University Medical Center and Division Director of Pediatric Hematology and Oncology, and also Dr. Phyllis Townsend, who's a practicing pediatrician for 31 years here in the Nashville area, and also a patient of HPV-related cancer. So thank y'all for joining me today, and I thought we would take this opportunity to kind of have a discussion about HPV and the experience that we have all had in different ways and shapes and forms. And Phyllis, let's start with you if we could. Tell us a little bit about your story as a cancer patient.
Well, Rob, I like to think I was laying on the beach, enjoying the sunshine last April when I started to have a sore throat. Didn't think much of it, but over the next 3 days, it got worse. I started feeling badly, and I stopped to look in the mirror and realized my right tonsil was more than twice the normal size and had my uvula pushed over to the side. Not thinking about cancer, I reached out to an ENT and said I thought I had an abscess. He prescribed some antibiotics and Decadron, and then I saw him the next day. I was already feeling better, so we proceeded with that course. Saw him again in a couple of days, was much, much better. But he said, I want to see you back in 3 weeks. Make sure things have gone back down to normal size. And when I returned in 3 weeks, my tonsil was better, but was still pretty large. So from there, we went on and I had a CAT scan, which showed a 3 centimeter mass within the tonsil, and I had some enlarged lymph nodes on that side of my neck. And then 3 days later, I had a tonsillectomy, and it turned out I had HPV-16 squamous cell carcinoma of the tonsil. And to say that was life-altering would be an understatement. So I spent the next 3 weeks going between post-op recovery, seeing a radiation oncologist, seeing a medical oncologist, and they laid out a plan for me because it turned out I had stage 2 because the size of my tumor was actually 5 centimeters, not 3, and I did have some positive lymph nodes. So in the middle of June of 2022, I started weekly chemotherapy. I went every Monday for chemo, and then for the next 6 weeks, I had daily radiation. And while the chemo was not the difficult part, the radiation was absolutely the most difficult thing I have ever done in my life. Now, I've birthed 2 babies and had 2 shoulder surgeries. Those are pretty painful. Nothing compares you for radiation in the mouth. You go in every day, you get undressed, put on a gown, and then you lay down at a table and you are strapped to the table. They put a mask, a radiation mask over your face, and you're clipped to the table so you cannot move at all. So here's a picture of me in my radiation mask strapped to the table. And I would lay there for about 8 to 10 minutes every day. And the first couple of weeks weren't so bad. By the end of the second week, your mouth begins to get very dry. It gets very raw. Swallowing becomes incredibly difficult. And then it just built over the next 4 weeks, and then really for about 6 months afterwards. So I went at least 3 months where all that I drank was water and Ensure. I could eat very little food because it just hurt too much to swallow. And I think my family would tell you it was just I would just sit in my recliner all day long between treatments, and I was just miserable. They were very good about providing me with pain medicine. Luckily, the chemo was not the difficult part. It was really the radiation. But I basically lost all taste and smell for a couple of months. I didn't realize I'd lost my smell until my family held a bottle of garlic under my nose, and I had no idea what it was. And then after 6 weeks of radiation, they kind of implied that after a couple weeks, things would start to get normal. And I would say in the middle of October, so 3 months after I'd finished treatment, by that time, I didn't have as much pain. I just had no taste. I would put food in my mouth and have no idea what it tasted like. I could describe the food because I knew by their texture, because I could feel the texture, but I couldn't taste it.
I think you told me you lost your taste of wine, which is
Yes, that was particularly painful. And I'd say probably by November, some of my taste started to come back. But even today, my mouth is incredibly sensitive. I don't go anywhere without water because my mouth is chronically dry. I can have no spice whatsoever on any food. I've become a very difficult person to wait on in a restaurant because I want to know everything that's going to go on my food. And the other thing that was surprising to me was just the grinding fatigue that lasted for about 9 months. I would, go out and think I was doing okay, and I would just have to stop, and I'd look at my husband and say, I have to go home now. I need a nap. And that took about 10 months to fully recover from the fatigue. But even today, I am very careful about what I eat. Haven't had Mexican food in almost a year, which is some of my favorite food.
And it's been a year since your diagnosis?
It was a year since I started treatment. Last Monday was 1 year since I had my first treatment. Now, the good news is the prognosis is very good. But, I'm left with these side effects that may or may not get better. I have some lymphedema or swelling in my face. I have these big circles under my eyes that are remaining lymphedema. I have some in my neck and my cheeks. So yes, I'm cured, but I cannot say I'm 100% and no idea whether I'll ever be 100%.
Yeah. So that's a lot of the physical toll you've talked about. Talk to me about the emotional toll, like especially, I mean, you went through this thinking, oh, I've got an abscess, even up to the tonsillectomy, you
Yeah,
thought you
I
had
was
an
hopeful.
abscess. And so at some point that talk happened and you have cancer. And tell me about the immediate thoughts and then,
Well, I didn't know much about HPV-related cancers at the time, though the ENT had told me that was on the list. But just hearing you have cancer is one of the scariest words in the world. You think about your kids. I was a partner in a practice that was going well. I was getting ready to start the summer checkup season, which we all know is a grind, but uh, a very important part of the season. And suddenly I couldn't work. Uh, my oncologist told me I just wouldn't be well enough to work, that my job, I needed to be too mentally sharp, and that I wouldn't be sleeping well, and I'd be on so many pain meds that it wasn't safe for me to practice. So you hear cancer, you got to call your kids and tell them you've got cancer. My husband wasn't even home when I got the call, so it's pretty terrifying.
I can imagine.
And then to think that this could have been prevented with a vaccine.
Yeah.
Why would you not want to prevent cancer in your children? Yeah, so I didn't get this till I was 60, but had I had the vaccine when I was 11, I had one of the forms, I had the HPV-16 virus, which is in the vaccine. I could have avoided this altogether.
And Deb, maybe you can, I mean, what do you tell patients when they talk about this and how do you relate why this, the importance of that vaccine in preventing these cancers?
So thank you, Phyllis, for telling us your story. There is nothing more important than people hearing it from someone who has actually lived the experience. When I talk to people about the HPV vaccine, it is difficult because you made an important point. You said you were 60 when you got it. And we're talking to parents of children, ideally, right, between the ages of 9 and 12 years, which is really when we want to get that vaccine in. So, one, I have to reframe it for them. So, this isn't something that their kid is going to catch in the next year. This isn't something that their kid is going to catch in the next 5 years. And the cancers that we're going to prevent are cancers that are going to occur decades later. And people think, well, that's fine because we have time. Since the cancer isn't going to occur until they're in their 50s or 60s or 70s, it's fine. We have time. And the point I make to them is no, you need to give this vaccine before your child is exposed to the HPV virus, which is the way we give vaccines for all childhood diseases. We don't give a child measles vaccine after they've had the measles. We give it to them before they've been exposed so they don't get the measles. I make sure that the message is this is no different than any other vaccine where you want to give it before your child's exposed. And this is a cancer prevention vaccine. That is its one and only goal. And it prevents more than 90% of HPV associated cancers.
Yeah.
Yeah.
And I think you're exactly right. I mean, it's hard to think of something 30, 40 years down the road. And people don't want to have these discussions. There's so much disinformation out there that they're battling it. That's right in their face today. And they're trying to push that aside or grapple with that as opposed to something so far down the road. But I always tell people it's much easier to have this difficult discussion about getting a shot or two shots than to have the discussions that you had to go through, which is you have cancer. And that will happen. If it's my children, it's happened probably long after I'm gone, but I don't want to leave them with that possibility that they will have to deal with that diagnosis one day and deal with all the things that go with it. And Deb, I think you're exactly right. I mean, we talk about what these parents are thinking about, and it's a very distant something that's going to happen 30 or 40 years from now. And then currently all that disinformation and things coming at them right now, or their child saying, I don't want to get another shot, that kind of drowns out the importance of it, I think, sometimes. And so, as difficult as that conversation is to have at the time the shot is due, it is much more difficult for me to leave that conversation 30 years later for where my child might, have to listen to, you have cancer. And so I think it's important that we keep preaching how important this vaccine is. So Phyllis, one thing you mentioned in leading up to your diagnosis was your dental visit. And we talked about that before. And I wonder if you could talk a little bit about that and the importance of that.
Well, I had seen my dentist probably about 6 or 8 weeks before before I had the sore throat, and I can only imagine my tonsil was quite enlarged at that point. And but at that time, I did not see the dentist. I only saw the hygienist. So I've always wondered, had I seen the dentist that day, would they have noticed my tonsil was so big, encouraged me to get evaluated sooner? Because in reality, if my throat hadn't begun to hurt, I wouldn't have noticed. I don't look in my mouth very often. But because of the diagnosis of cancer, I had to get all my amalgam fillings removed and replaced at no small expense. I now have to see the dentist every 3 months. I sleep at night with basically a retainer full of fluoridated toothpaste to try to protect my teeth. Because when you don't have saliva or enough saliva, you're at much higher risk for cavities. And in fact, I've met someone whose teeth are crumbling from her radiation treatment. So, yeah, you may get on the other side of the cancer, but there's still long-term consequences you need to worry about. So, taking care of my teeth has become incredibly important.
Well, and I think that's an important point too, because I think for a lot of adults, they probably see the dentist more frequently than they see their regular doctor for checkups and things like that. So it's important to keep your dental visits and maybe even ask your dentist, everything
Yeah,
look okay back there?
I think you're right. I think you're right. Because had mine been discovered sooner, maybe I would have just had radiation, which still would have been a miserable treatment, but I wouldn't have had to get the chemotherapy as well.
And if I'm thinking about what may happen to my children, grandchildren, all the extended family, what was the hardest part? Maybe not on you, but on the family members, your husband and children.
I think my kids would tell you that I was kind of the one who was sort of the strong person at home. I took care of business, made sure things got done. And I sat in a recliner. I was a pitiful person for probably 8 to 10 weeks. Just sat in my recliner and didn't leave the house except to go to radiation. And I think it was very hard for my kids to see me like that. And then I had the added stress of being a business owner and thinking, I'm not at work. What's happening to my patients? I had several patients that I was kind of in the middle of workups of problems or starting medication. And truthfully, I just didn't have the bandwidth to worry about them, which made me feel terrible. But I just couldn't.
Well, I'll add on to that. There were a lot of us in the pediatric community that were worried about you too. We were
Yes,
all asking around, how's she doing? How
I
things going?
appreciate that.
So you've gone through this experience now, and I know you're retired. Congratulations, by the
Thank
way.
you.
Um, Maybe a question for both of you, but especially for you. If you were to go back and you run across those vaccine hesitant parents again who really say, I don't want my child to have this HPV vaccine, surely you must think about it even more so now.
Yeah.
What would your
I mean,
response be?
I would tell them my story. I would say, look at my mouth. Look at how dry it is. Um, look at the swelling on my face from the lymphedema. Do you want this to happen to your kids? You might not be around to nurse them when they're sick.
Yeah.
This is a misery on your child you can prevent.
Yeah.
Who doesn't want to do that?
And Deb, I'm sure you kind of counsel the same way.
Yeah, I think it's very important to put this in the context of the family that this vaccine will assure that you will have time with your children will have time with their children. And that's something, there are so many cancers that we can't prevent. So many. As a pediatric oncologist, every time I tell a parent their child has cancer, I break their heart.
Yes.
And the first thing they ask me is, what could I have done to prevent it? And to our knowledge, we don't have any prevention. And for the most part, for adult onset cancers, we don't have prevention. But this is a set of cancers where there's prevention. So we try to frame it in a family-centered way, that this is one way to help generations of your family. And it starts now when your kid is a preteen by giving them the HPV vaccine.
And I think we're going to talk about this in a separate lecture, but this is something everyone gets. I think 80 to 90% of us are colonized. So basically everyone, in this room possibly has HPV. And it's just, once you get it, it's a little bit of a crapshoot about who gets the cancer from that. And we've talked a lot about cancer, and, we're going to see those numbers come down if HPV vaccine takes hold. But even now, I think we're seeing some of the stress lessen for those younger folks who may have precancerous lesions or abnormal pap smears. And correct me if I'm wrong, but I think we're seeing those numbers come down already.
We are seeing those numbers come down. So since the vaccine has been in effect and with increased use, we've seen decreases in precancerous lesions and HPV diseases that are, that would ultimately lead to cancer that aren't cancer now. And in countries who've had better success at the vaccine than we do, who've mandated it for school entry, et cetera, and have been doing it even longer, their cancer rates have really started to plummet for HPV cancers. We haven't seen that decrease in cancers yet in the United States because of that huge latency period, and because our vaccination rate still in the United States is suboptimal. But in countries where it was instituted, mandated, they've had enough time to start to see decreases in cancer rates.
Yeah.
So we know this vaccine works.
Right. So again, it's not just the physical and mental stress of a cancer diagnosis, it's the precancerous lesions and, oh my gosh, what's that going to turn into? And we're seeing that impact now. So Phyllis, before we close, I wanted to give you an opportunity to kind of say anything you want.
Well, Rob, to think that this was all preventable, that there's now a vaccine that could prevent this misery and terrifying time to my family, and is, to me, makes me feel a whole lot better, because there's something you can do to prevent it from happening. I just can't encourage families enough to get their kids vaccinated with the HPV vaccine. Don't make one of your children have to go through this as they get older. I just can't tell you how difficult it is and how frightening. Thank you for letting me tell my story.
Well, thank you. And for those of you watching this, thank you for being a part of hearing this impactful message. And for all of you, we hope that you stay well.
Well, your videos were entertaining until you got better, because you got sick after me, you got better before me, and so I resented you just a little bit for that. But we've squared it away since then.
Uh-oh.
Like, what happened to me?
Oh, no. Did that come off the...
I don't think it came off the chair, yeah. As long as my hand's not in the... I got it on my boob, yeah.
You move it. Your peril. Don't do it.
I'm not a pro like you.
And then whenever he references you guys, give a nice smile. Just imagine I'm coming to dinner with you guys.
Genuflect, right?
Yeah.
The audio is crushing me out there. Are we in trouble? Like,
I don't know. Are they coming for you? If I hear a helicopter.
I mean, there's freaking Blackhawks out there.
He's our fearless leader.
Right.
Maybe I'm just hallucinating.
You've done too many of these, Michael.
Yeah.
Right? I mean, we've known about SARS-CoV-2 for... Oh my sweet Lord.
I can be very particular about things, but not about this.
And then I can break that wall and just look at the camera. Is that okay?
Closing statement sounds like I'm an attorney.